Okay, thank you everyone for being with us today. Welcome. Sorry, I'm a couple minutes late here. We just had a lot of information to go through, and I'll try to race through this information to update you the best I can. Sorry to report 2 new deaths this week. One reported Sunday and Monday. It brings us to 144 total positive, 9,664. That's a plus of 44 on Tuesday, 25 on Monday, and 31 on Sunday. The R0 rate still looks good, under 1%, as you can see there. The areas of impact are still primarily the same as far as those who are getting COVID and the race, ethnicity side of things. And then, unfortunately, those who have passed away from COVID remain pretty much the same. The good news is on our hospitalizations down to almost a record low for a long time now. We haven't seen these numbers fall this low to 33 confirmed, with 5 suspected, 0 out of county, lots of capacity in both ICU and the general beds that are available. Positivity rate has fallen. We've now tested over 160,000 people in this county. That is amazing. The average turnaround time is coming down also, which is something that we had very much hoped for. So that is coming to fruition. Just a couple updates on the numbers as they appeared last week. Tuesday in Daly City, we had 760 tested with 96 walk-ups. Wednesday, the 16th, Daly City, 727, 130 walk-ups. On the 17th in East Palo Alto, 539 with 113 walk-ups. Friday in San Mateo, 869 with 163 walk-ups. So as of last week, a total of 42,542 have been tested by Verily at the Verily sites. We have a no-show rate of 11.5. We'd like to see that come down, and people, if they sign up for a spot, show up. It is painless and it is quick. And the Verily site can now now accommodate up to 1,000 a day. And I'm going to talk a lot about testing because that is key. This week, just for an update, Wednesday we're in San Bruno, Thursday North Fair Oaks, Friday North Fair Oaks, Saturday San Mateo, Monday San Mateo, and Tuesday Half Moon Bay. So we all know the blueprint for a safer economy metrics have changed. We have moved from tier 1 to tier 2. So we are in red now. We are seeing red, and that is a good thing. But we want to maintain that. We have joined the ranks of other Bay Area counties like San Francisco, Santa Clara, Alameda, and Marin. As we see Contra Costa and Sonoma still in the purple. So as a reminder, the new framework places counties in tiers based only on 2 things, the case rates and the positivity rate. So why don't we show that? So I'll just show you the blueprint, how we got there. You can see that back in the week of August 31st, we had a positivity of 5.20. And then the adjusted case rate of 7.7, I believe. And then the following week, we had a 4.10 positivity rate. And we can see that our adjusted case rate was 6.0. So that was a low point for us. That was great. And we want to get back there. We want to dip that further down. It came up a little bit this week. The positivity rate came up to 4.5, and so did the case rate to 6.8. Because of testing, we were able to drive that down to 6.6. So we want to continue to drive those numbers down and stay in tier 2 and progress to tier 3 if possible. But we know that for schools to entertain reopening, they've got to be at tier 2 for 2 more weeks. So we got 2 more weeks in the red before they can entertain opening without the waiver. And then in order to move to the next tier, we've got to be in red for 3 consecutive weeks to get to orange. So the great thing is that because we're in red now, that restaurants can open indoors 25% capacity. All retail can move to 50%. Shopping center swap meets indoors can move to 50%. Personal care services, hair, nail salon, barbershops open with modifications. Museums, zoos, aquariums, 25%. Places of worship, 25% indoors or 100 people, whichever is fewer. Movie theaters, Movie theaters, we haven't seen them open in a long time. Can move indoors, maximum 25% capacity. Gyms and fitness centers, haven't seen them from a long time. Move to 10% capacity and more. But you all know where to go on the state site and look at that. So I think the message is that we've got to continue to reiterate is we cannot let our guard down. We have moved to red because of the diligence of the folks in this county who have adhered to those safety precautions that would progress us to opening more businesses. So we want to thank them at this point in time, but we want to ask them to continue their vigilance and continue washing their hands, socially distancing, not gathering in masses, and making sure we wear that face mask. And I'm going to add one more: get a test. Go get tested. So we're going to continue to emphasize that. And, you know, tier 3 is certainly somewhat more difficult to get to, as we know that we have to have the positivity rate down between 2.49 to get to the orange, between 2 and 4.9 to get to the orange. We're actually in that right now, so we would qualify for that. It's the case rate that has got to be driven down substantially, and that is got to be between 1 and 3.9. Again, we were at 6.8 adjusted. I'm sorry, 6.6 adjusted. So we've got a ways to go. But we also know that, you know, matrix have been put in by the state that allows us to kind of determine our own destiny in some ways, or at least participate in that destiny through testing. And we're going to talk a lot about that. Remember that when we're looking at case rates, we're talking about a 7-day lag. So keep that in mind. So now let's go on to testing, because this is key. This is an area that's absolutely key. Not only is it important for folks to get tested to know if they're an asymptomatic carrier or not, but it will help us with our case rate determination. As you know, in addition, under the blueprint, performing greater amounts of testing may assist counties in moving to a less restrictive tier. So as a result of not only wanting to know who is has COVID-19 so we can get out in front of it, there's an incentive. There's an incentive to provide greater testing in your county, because it will help lower your case rate as looked upon by the state. So this week, we have now directly contacted with Verily. Remember, the state provided 2 sites in San Francisco, 2 sites in Santa Clara, but 1 site to us. And we've been operating with Verily at that 1 site, and we want to thank them. They have been great partners, but we only had 1 free site in this county, and we've taken to moving that around to hit those areas that are most vulnerable and bring the Verily testing to them. So now we are going to contract on our dime with Verily. We are going to pay for it. And we're going to contact directly with the project baseline operation. So beginning September 25th, the county will have concurrent project baseline operations, adding the capacity of about 5,000 additional tests every week. And this is tremendous. And we hope that people will avail themselves of this service. So here's how it's going to work. Starting Friday, September 25th, there will be a project baseline site at the event center permanently, 5 days a week. It'll be Tuesday through Saturday. We wanted to add that Saturday capacity for those who have childcare issues during the week or are working during the week. So it's Tuesday through Saturday with a capacity of at least 1,000 a day. And we want to make sure we get at least 1,000 a day showing up there. So that will not be moving around. That will stay there day in, day out, 5 days a week on a Tuesday through Saturday, and it'll be available for those who cannot take time off for Saturdays. In addition to that stationary San Mateo site, we will continue to rotate 1 project baseline operation 5 days a week, Monday through Friday, and this is the one that we are paying for, to serve locations north, south, central throughout in the coastal area throughout the county. So that'll include Daly City, San Bruno, Half Moon Bay, North Fair Oaks, in East Palo Alto. And that's to make testing more accessible to all those in the county. But that will be available to only those who live or work in the county. Since we're paying for it, it'll be for those who live or work in the county. But we want people to get tested. We want them to avail themselves of the service. We want people to fill up every appointment that we have, because it'll help us twofold, not only on knowing who is positive and then getting our contact tracers in place to advise other people to stem the spread of that disease, but it'll also help us on our case rate numbers by driving those numbers down the more we get tested. So we are also seeking to add a permanent lane at the event center that will test kids 5 and under, but we need to work that out a little bit. We did that last week. We had 86 kids. There was a few areas that we need to smooth out in regard to getting those kids in and how we separate those lines and how we direct people in. So we're going to halt that for right now temporarily, but we're going to make sure that we get kids included in this if they're 5 and above. So the news is 2 contracts with Verily, 1 provided by the state, 1 provided from the county right now to add about 5,000 a week to our testing capacity. In addition to adding capacity with the second project baseline, we've also continued to add local neighborhood testing events throughout the county. Excuse me. So this is important because when we see those areas of concern, we have the ability to go in and work with cities to set up immediate testing in areas. It may be an apartment complex, it may be a block in a particular area, it may be a census tract area, whatever it may be, but we have the ability to go in and do that. And we've had about 6 scheduled so far. Over the next week and a half, we'll have about 6 more scheduled. And so far, we've been partnering with East Palo Alto, San Mateo, Redwood City, Daly City, Half Moon Bay, Brisbane, Millbrae, Menlo Park Fire District, Pacifica Police Department, and Puente, all great partners who are helping us with that. So testing is key. So not only do we want to say wear masks, socially distance, wash your hands, get tested, especially if you're an essential service worker or in high contact with a lot of people. We want those people tested. Those people on the front lines should get tested. Additionally, just a kind of an update real quick on the AHS Redwood City. We've got 16 guests and 15 rooms. Thank you, Connie. And the Bayfront Canal, the Bayfront Station, we've got 93 guests and 83 rooms. And then throughout the county, we've got another 97 guests. These are the homeless populations. So we've got almost 184 people now off the street that were previously homeless in hotels. The Immigrant Relief Fund is doing fantastic. It is 95% expended right now. They have served over 10,066 people on these $1,000 grants in that $10 million fund, $10 million plus fund. The Great Plates program continues to be an incredible success, served 2,740 participants, delivered over 500,000 meals at this point in time, 68 active restaurants participating, employing people and putting money back into the economy. And as we reported before, it will be continued through October 9th. Community affairs, very quickly, they're doing a terrific job. We are at 77.8% on the count right now. We still lead the state. We have 7 days to go unless this court decision comes down requiring the census to go through October. We are anxiously awaiting that. Without that, it will end at the end of this month. So we are definitely awaiting that. The Mass Mobile is getting out there. It's being recognized. It's pulling up in neighborhoods, and it has kids coming up and getting masks. So we very much appreciate all those efforts out there. And certainly there's a calendar here that we can send out or post showing you. But it's also been featured in multiple news stories this week, including English and Spanish language outlets, which is something that we're very proud of. And then the COVID-19 outreach, and folks ask, what is going on in some of these areas like East Palo Alto as far as rates? We do have higher rates in those areas, and it really comes down to the fact that we have essential services workers living in crowded conditions who are exposed to more people because they're the frontline workers. And the fact that they're living in crowded conditions it really causes others to catch it and pass it on. And it's very, very difficult when a whole family catches it and with all the contacts they have also. So people ask, well, what are you doing about this? We are concentrating testing in those areas. We know where they are around the county. We are getting education out to them. Health has the ability to isolate people, to pay people lost wages, to get food to them, to families in need. So there really is no reason to go to work if you are sick. We want to make sure that people understand that there is an alternative for them if in fact that is the case, and that is part of our educational process getting out there. We are certainly getting masks out to those neighborhoods where we believe that there's a disproportionate spread. And we are constantly watching for that and doing more testing. So with that, I'll open it up and see if there's any questions.
We can start with one question that's on written so far. It's from Sarah Wright, and
Yes.
asking for clarification of what time the Verily testing will be open on Tuesday through Saturday.
It's 9 to 3, 9 a.m. to 3 p.m.
And all right, we have a hand from Sierra Lopez.
Sierra, how are you?
Hi, I'm good. Thank you. How are you?
Good, thank you.
I'm good. So my question is about enforcement and keeping the county in the red and moving along. We saw before when the responsibility was placed on residents to wear masks and to social distance, we still had strict restrictions placed on us. What is, the county's method or measures that we use to enforce, mask wearing, social distancing at some of these businesses that have just reopened?
Yeah, for sure. Sarah, good question. I got to tell you that certainly it's in the best interest of these businesses to adhere to these guidelines and these requirements, because really their livelihood depends on it. If we move back into purple, we're going to have to shut down many of these businesses again. We'd rather move forward into orange and open more up and create more capacity. But it's going to be absolutely imperative that they follow the state requirements in making sure that they maintain that 25% indoor restaurant, and they have the barriers and different things that they need in place to make sure that people are 6 feet apart at the very least. And some which you go more than that, just to be safe. And you see some places doing that and doing it very well. But we are looking at that to determine if there is a mechanism to report places, and can we put a structure in place for that. But I think most of these businesses understand that their livelihood really depends on this, and they want to. And we're, as we're out and about, we do see that. We see that people are not wearing masks, are very few, and they are subject to a citation. I'm proud to see as many people in this county wearing a mask as we're seeing, and I can tell you, those are the things, adhering to those requirements of social distancing and wearing a mask and washing hands and now getting tested are only going to aid us in moving to the next tier, and at least at the very least keeping us where we're at today.
Just a quick follow-up question to that then. Is there any available information on what types of businesses have received, some type of citation and how many?
Sarita, I'm not aware of any, but I know we'd rather work with the businesses and cite them, but at some point, if they continue to flaunt the law, we would cite them. So, but do you have any information on that?
I don't know that there's a central collection because different cities are enforcing, through their non-emergency law enforcement. I don't believe we have a collated total.
Okay.
We now have a hand from Henrietta Burrows.
Henrietta. how are
Hello.
you?
I might have missed it, but I didn't hear the testing dates and sites for East Palo Alto.
Yeah, let me get that for you here. On the rotation, I've only got the stats through the 29th, and they are not on the rotation. They were on the rotation. Let me see here, going back.
Like she can go to the website. The county's website was all the dates.
Okay, thank you, Connie. Yeah, so it is on the website, but I was just looking for the dates that we had them. For some reason, I must have it over here. So we were in East Palo Alto, I believe, last week. So yes, Thursday the 17th, but we do put them on the website so people have an opportunity to see where the best place for them to get tested is.
Okay, so that's currently posted on the website?
Yes, should be.
Thank you.
Okay, any other questions?
We have another hand here from Sierra Lopez.
Yes. Sierra, how are you?
Sorry, I had to try to get myself unmuted there.
No problem.
I wanted to ask a question then about testing children. What were the hurdles you saw or the county saw in getting kids tested at the site? What the time frame is looking like in being able to implement getting kids tested again sometime?
I think it was more logistics. How do you separate cars when you have that many coming up and get them into a right line? And I think that we just want to take a look at that. We're going to try to get that going as soon as possible. The ability to do it is there. And I don't know if Justin Mates is on and wants to address that a little bit more as to the timeline. It doesn't look like Justin's on, but in talking with him, I know that it's something that we hope to get up and running very quickly. It was just more logistics than anything else, as far as they operate a little bit differently than the other sites, and it's a different vendor. So we wanted to just make sure that we work out some of those areas that we saw were not exactly working the way we had hoped to, as far as streamlining people through.
And Mike, just a clarification about the testing dates in East Palo Alto. The team is updating the site currently, so that information will be up in a bit.
Great, thank you.
Sorry, really quickly, by different vendor, does that mean that Verily is not the administrators of the test for children?
That's right.
Do you know who the vendor is?
Curative.
Curative. Thank you.
And we have another hand from Henrietta Burrows.
Yes, thanks so much. Sierra reminded me of the question I had in terms of children, and you had mentioned that about 80 children had been tested, and I'm wondering, are children treated when they have COVID the same way adults are treated?
Sarija?
Overall, pediatric medicine is distinct from internal medicine or adult medicine. So, really defer to the pediatrician community. And there are many pediatric experts serving our community. Lucille Packard Children's Hospital has been a great partner.
Great.
Thanks.
Anything else?
If you have another question, please raise your hand. Otherwise, we have no hands raised or other questions.
Okay, well, we are encouraging testing. So as you can see, we've got increased capacity. We need to fill that capacity. So please help us get the word out on that. Other than that, thank you all for being here with us today, and certainly hope that you stay safe and healthy, and we'll see you back here next Wednesday.